Hello, everyone, and welcome to our Admitted Student Week here at MCPHS University. First and foremost, congratulations on your admission to the nursing program here at MCPHS. My name is Rachel Draper. I'm one of the assistant directors of admissions here, and I'm joined with a few of my colleagues here at MCPHS University from the School of Nursing. I will let them introduce themselves. Dr. Gravel, why don't you go first?
Congratulations on your acceptance to the School of Nursing. I'm Interim Dean and Chief Nurse Administrator, Tammy Gravel. I've been at the university for 15 years, and I really look forward to you joining us.
Thank you so much. McKenna, why don't you introduce yourself next?
Hello, my name is McKenna, and I am in my last semester here at MCPHS, and I look forward to sharing a lot of information about why you guys should choose MCPHS to further your nursing education.
Thank you both so much for being here tonight. We really appreciate it. As I said before, this is going to be a panel discussion, really getting some information out of our faculty and our current student to share with you what it's like to be a nursing student here at MCPHS. So I'm going to get the conversation started with a question specifically for Dr. Gravel. Can you please describe some strengths of the program, especially our BSN, and why you think it's the best choice for students when pursuing an undergraduate nursing degree?
Thank you, Rachel. I think one of the most important pieces is the faculty and student partnership. The faculty is truly invested in the students across the School of Nursing. We have 3 campuses and a graduate program, and we find that faculty are committed to teaching on both sides and bringing their clinical experience to the student. I think another strength is our relationships with our clinical partners. Many of our faculty also have practice time within our clinical partner agencies, and they receive positive feedback all the time on our students, whether they're just starting out on clinical or getting ready to transition into professional practice. Another strength is our graduate students who have moved on to clinical practice and decide to return as alumni tutors, or when they meet the intent of the boards of nursing, they come back as adjunct clinical faculty. And they bring our students to clinical. They're able to understand what our students are going through because they've been through the curriculum and certainly understand the rigors of an accelerated program. And I think the final strength of the program that I'll mention right now is our positive NCLEX outcomes. Part of your education is certainly navigating through the curriculum successfully, but the other piece is being prepared to pass the NCLEX licensure exam. And you need to do that in order to transition into practice. And we have been very lucky in our results and our outcomes across our School of Nursing. We are above the 80% percentile required by our accreditors and our boards of nursing. And again, students are, that's evidence that the students are well prepared in order to transition into practice.
Thank you so much for sharing your perspective on that. As a faculty member in the School of Nursing, what do you enjoy most about teaching at MCPHS?
I really enjoy teaching. I really do. I've taught every course across the curriculum minus pediatrics and maternity. I enjoy meeting with students before the class, after the class. They also are asking questions about transitioning to practice. What are the key strategies for interviewing and resume building? Many of them circle back to me and ask, if I'm going to apply for this job, what would the questions I'd be asking? And I think that that's really helpful for the student and also makes every moment really important to me as a faculty member.
That's so great to hear that you have had such a positive experience teaching our undergraduate nursing students. McKenna, I'd love to hear a little bit from you. I know you're on your way out in your last semester. Congratulations.
Thank you.
But can you think back to your college search process when you were an admitted student, just like the students who are listening tonight? Why did you choose to come to MCPHS?
Yeah, so I'm originally from New York, so I definitely had a lot of options there and a lot of options in Massachusetts, but Boston and MCPHS being the center of that Longwood medical area, all of those great hospitals around really drew me here. And then they do offer the accelerated program, which I haven't seen many other places. And when I was searching for a college, I really was interested in making sure that the college I'm going to is going to support my learning and provide me with tutors and kind of just be able to help me throughout the program because I know how rigorous nursing is. And I found that here at MCPHS when I came to my accepted students day, all of the wonderful things that they were saying about how they really support their students throughout the program.
Thank you so much for sharing that. Kind of to piggyback off of what you kind of alluded to, can you share some examples of how you feel the nursing program has prepared you for the career that you'll be starting this summer?
Yeah, being able to have the professors, kind of like Dr. Gravel was saying, that have been bedside nurses and have been into the program and have graduated and passed the NCLEX has really given them the perspective, the great perspective that they can share with us. And I think that also utilizing the tutors and utilizing just the MCPHS kind of professional relationships that you build throughout school has really helped prepare me to go into a healthcare field. Your classes are with other students, obviously in the nursing program, but during your prerequisites, you are with PT students or pharmacy students. So you really develop all those relationships that you might work with them later on. So it's really been a great, just healthcare driven school to be at.
Thank you so much. I want to turn it back to you, Dr. Gravel, to tell us more about the School of Nursing and all of what our faculty are up to. Can you provide some examples of accomplishments, appointments, or accolades for faculty within our School of Nursing?
Absolutely. Many of our faculty are part of our Honor Society, Sigma Theta Tau, as well as our students. Many of them go on and be scholars and publish. We've had opportunities where students have also gone on and published in collaboration with faculty. So I think that those really resonate with students coming into the program. And many of our students, this is their first level of education. They're starting their BSN, but plan on moving on to a master's degree or, aligned with a nurse practitioner degree. So it's a great opportunity to prepare for that scholarship piece of nursing. Other accolades that we've received are in the area of interprofessional education. McKenna just mentioned that a few minutes ago. We do Schwartz rounds across the 3 campuses. We also have interprofessional activities each semester that allow the interaction between our health professions disciplines, and you get used to and comfortable communicating with a pharmacy student or a PT student or OT student. And all of those pieces are hugely important as you transition into care and care for that patient at the bedside. You need to be able to communicate interprofessionally. Some of our faculty have achieved their doctorate degree here at the university as well, and they have advanced their education and again brought that back to the bedside. Back to the classroom and the bedside, quite honestly. So I think that those are really wonderful accomplishments of the faculty across the School of Nursing.
That's wonderful. Thank you so much. I know, we're preparing students in the nursing program to be general practitioners in nursing, but what other tracks or career paths could a student take with a BSN and eventually their registered nursing license?
That's a great question. Our students leave here and they can be, in acute care from any department, whether it be med surg, intensive care, trauma, ED. We've had students that have left here and gone into residencies for the emergency room, for example, at Boston Medical Center, and then have gone on to be a Boston Med Flight nurse. So we've had some great accomplishments by our students. We've had students that have transitioned into pediatrics and maternity because that is their passion. We've also had students that have gone on for their psych mental health nurse practitioner role, which, as we know, it's a huge need right now across our country. Mental health is certainly something that we need to focus on in order to support each other, as well as our patients in the healthcare setting. So I think that students really have the global perspective when they leave here, whether it be in acute care community or transitions of other healthcare areas.
Definitely a lot to consider when going to nursing school. McKenna, now that you are almost done, you have a few months left. Do you have any specific plans for once you pass the NCLEX exam?
Yeah, so after the NCLEX, I'm thinking about going into either maternity or pediatric nursing. Like Dr. Gravel said, it is really one of my passions, and I'm sure a lot of other students in this program have the same. And I'm also going to apply for my MBA in healthcare management program at MCPHS, which is one of the 6 advantage scholarships that they offer. And so I'm planning to apply for that in the spring of 2022, just so I can start as a new grad with less stress than adding another degree in. So that's my plan right now. It could change on the drop of a dime though. So
Well, we're so proud of you, of course. We're so
Mm.
excited to see what you will be doing
Thank
after
you.
you pass that licensing exam. If you can think back to, your first couple of years at MCPHS, what kind of outside activities outside the classroom, like internships or volunteer experience, or even your clinical rotations, did you participate in um, to prepare you for your career in nursing?
Yeah, so being in Boston, there are multiple hospitals you can work at or volunteer at. There, most of them are teaching hospitals, so they want students and they want them to gain experience. So first 2 years of school, I worked as a PCA in home health care, and then right now I'm currently at Tufts Medical Center. I started volunteering, and then I got a job as a PCA as well. So all of that kind of has helped bring my classroom learning into real life. And during my clinical experiences, currently I'm at Mass General Hospital, and it has been wonderful. The clinical instructors are always there to help and want their students to see as much as they can. And I think that's really important to go to a school that has strong clinical instructors, because that's where you learn your hands-on skills, and they're there in the front lines with you, and they teach you, and they send you off into the room. So it's really nice to have clinical instructors that really want you to succeed and want you to gain the experience that you can.
I'm so glad you took advantage of everything that MCPHS has to offer. That's wonderful. I like to end these conversations on sharing some advice for the admitted students watching tonight. Dr. Gravel, you've already shared a lot about student outcomes and what our students are doing and what they can be doing after graduation. From a faculty perspective, what is some advice that you would give to students really starting on their degree programs to really maximize their success at MCPHS?
That's a great question. I think a couple of things. The first piece is to, when you transition in, read. I can't stress that enough. I think utilize your resources, whether it's peer tutors, whether it's the alumni tutors, whether it's your faculty, make sure that you reach out to folks. I think one of the challenges we find is if we're not hearing from a student, we think all is okay, and it may not be. So I would take advantage of those resources. Go meet with your faculty advisor, have conversations, become, really familiar with that partner faculty advisor. I think the other thing too is to get involved within the School of Nursing. There are several, there's Nursing Students Without Borders, there's the Nursing Students Association, there's opportunities to participate in shared governance through the curriculum committee or the student affairs committee. I think all of those will help your experience during your tenure here. And again, I would take it because it's accelerated, and McKenna can certainly speak to that, is just really take one day at a time, one project at a time, one exam at a time, because otherwise it certainly can be, a little bit overwhelming when you first walk in. But I think students overall are able to acclimate very well to the School of Nursing. And again, with utilizing your support systems here.
Excellent advice. Thank you so much for sharing that. McKenna, from a student's perspective, what advice would you give our incoming freshmen?
Yeah, so my advice regarding the nursing school is that really be sure to make all those interprofessional relationships like we talked about earlier. I think these are the people you are going to be working with, so it's really important to stress that. And I think if you understand how you study and put in the work and the effort, you will do great. Like Dr. Gravel said, it is a little stressful starting out, but MCPHS, as well as the School of Nursing, also has other activities and stuff to kind of get you out of that school mode. So sports, pre-pandemic, there's the colleges of the Fenway. You can get into intramural sports or club sports, or I'm even in the physical therapy club, but I'm not a physical therapy student. So it's really just branching out even beyond nursing and just making your college experience the best that you can.
Thank you both so much for ending on such a positive note and sharing all that advice for all of our admitted students, whether you're a freshman or transfer student. Coming to the MCPHS and the School of Nursing, you are in great hands. You'll have a great experience, and you are well on your way to becoming the nurse that you've always maybe dreamed of being. So thank you so much for everyone for joining us. Dr. Gravel, McKenna, it's always a pleasure speaking with both of you. So thank you so much for your time. Congratulations again to our admitted students. Hopefully this information was helpful. If you have any other questions, do not hesitate to reach out to the admissions office. We're here to help make this decision as easy as possible. But thank you so much again. Congratulations. We hope to see you on campus this fall.